Welcome back to Dr. MacLean Explains. My goal is to break down the U.S. healthcare system into understandable parts, to clarify what is the problem with the system, and to talk about how to fix it. In segment 2, I will answer the question, how did we get here? I'll give a whirlwind tour of the history of medical care in the U.S., and I'll also look at the birth of health insurance. Let's start with looking at healthcare in the colonial period. The most famous doctor at the time was Benjamin Rush. He, like most reputable professionals of the day, got his medical training in Europe, in his case, Edinburgh, Scotland, the leading medical center of the time. Rush was a signer of the Declaration of Independence and served in the Revolutionary Army. He became the father of American psychiatry because of his interest in mental illness as a disease, not demon possession. Rush and other Orthodox practitioners in the early Republic, trained in the scientific European tradition, faced competition from a panoply of practitioners in an unlicensed, unregulated free market. They peddled nostrums like snake oil and procedures such as bloodletting. Doctors of all types trained like apprentices. The sick were cared for in their homes, with the poor going to almshouses and mentally ill to asylums. Port cities did have public pest houses for quarantines. By mid-19th century, Orthodox doctors began trying to solidify their place in the market. They did this through training at medical schools, beginning with Harvard, Dartmouth, College of Philadelphia, which eventually became the University of Pennsylvania, and King's College, which eventually became Columbia. But by 1850, there were now 42 medical schools that often were little more than diploma mills. The course consisted of only 2 semesters of 3 months each. The medical school needed only 4 faculty, 1 classroom, 1 dissection lab, and a charter to grant degrees. These schools were highly profitable. In 1847, the AMA, American Medical Association, was founded by the Orthodox physicians. Meanwhile, the era of scientific medicine was blossoming in Austria, Britain, Germany, and France. Here are some milestones: anesthesia, microbiology study of invisible germs, antiseptic surgery technique, and X-rays. In America, by the turn of the century, doctors in the AMA sought to further shore up their legitimacy by reforming medical education. States began requiring more formal education as a condition for licensure. The Association of Medical Colleges was founded in 1876. In 1893, Dr. William Welch brought to Johns Hopkins University the German model of education based on 3 or 4 years of training in clinical sciences. Industrialist and philanthropist Andrew Carnegie hired Abraham Flexner in 1910 to draw up a blueprint for medical school reform. Flexner is widely credited with ushering in the era of modern medicine in this country. In the early 20th century, doctors enjoyed prestige and independence. Courts ruled against corporations practicing medicine, ensuring the preeminence of private practice. Doctors joined together in hospitals to take care of growing populations in big cities and to exploit emerging surgical and diagnostic technologies. This brings us to health insurance. Surgery, which made great advances during the Civil War and World War I, and hospitals were becoming expensive. So, in 1929, Baylor College started the first prepaid hospital insurance. Baylor's 1,200 teachers each paid 50 cents per month to cover up to 21 days of hospitalization. Surgeons and hospitals quickly embraced this arrangement, and the Baylor Plan became the Blue Cross Plan in Minnesota in 1933 and Texas in 1934. By 1950, just 15 years later, Blue Cross covered 57% of the U.S. population. Here's how it happened. After World War I, the war-torn countries of Europe, like Germany, were in turmoil. Social insurance, including health care, helped reestablish some social stability there. But in this country, politicians opposed Teddy Roosevelt's plan to set up national health insurance for factory workers, calling public insurance a public Prussian menace. Labor unions saw public health insurance as an encroachment on their special role to ensure worker benefits. The AMA also opposed public health insurance as a potential interference with the practice of medicine. Then, during World War II, wages were frozen, but companies were allowed to give health insurance benefits instead. This sowed the seeds of the employer-based health insurance system. In 1948, the Supreme Court decided that unions could use health benefits in collective bargaining agreements, and then in 1954, Congress made employer-paid health premiums non-taxable. By the mid-1960s, employer-paid health insurance was nearly universal. Let's summarize the history of medicine from rush to Medicare. In the colonial period and early republic, there was intense competition among doctors of all stripes, those that tried to understand the scientific basis of disease, and those who peddled remedies on a trial and error basis, referred to as empirical, relying mostly on their placebo effect. We still see vestiges of this early competition today in the rivalry between MDs, DOs, chiropractors, and podiatrists. During the industrial period, little by little, science-based orthodox physicians in the European tradition prevailed over their rivals, introducing advances in surgery, diagnosis, and infection control. They shored up their gains with institutions such as the AMA, hospitals, and eventually insurance. In the next segment, we will look at reform movements, starting with Medicare and Medicaid in the 1960s. We will also look at why later reforms failed and where that leads us now. I'll see you then.